Thanks for the introduction. Good morning, everyone. My name is Kevin Cassidy. I'm with Blue Cross Blue Shield of Illinois. And with working for Blue Cross Blue Shield, that comes with a lot of responsibility related to the Affordable Care Act. It means we're supposed to be experts on the Affordable Care Act. And I'll tell you, that's, I hope I give you a good education today, but that is very, very hard to do, right? The law is complicated at best. It comes with new clarifications every day. It's even more confusing if you read the newspaper or watch any of the news programs, because that seems to contradict things. So while, with all that said, hopefully you can appreciate, I have to say this, we cannot provide any legal or tax advice, and the information that I am providing you as of today, October 28th. With that, let's have a very casual conversation about the Affordable Care Act. Here are some of the things that I plan to cover on your behalf, and there's a couple of experts in the audience that may be able to weigh in and talk about things. So let's please be as kind of casual and open in terms of questions. So I'll try to cover the following. I have a bunch of slides that hopefully will keep me on track. I'm going to remind everyone of what the intent of the law is. And I think if we talk about the intent of the law, that helps us remember, it helps us decide what we should and shouldn't be doing, or who this impacts and who it doesn't. So allow me to do that. With that said, we'll talk a little bit about who can buy on the exchange, who can buy and who can't buy on the exchange. I will get down to some basics. I'll define what the exchange is, the healthcare marketplace. I'll talk about the difference between a private exchange and a public exchange. And if at any point we're getting maybe into too much detail or too remedial, just wave and let me know. I hope one of the things we accomplished today is that we hit on what it means to your business. So as a manufacturer, whether you're a small business owner or a medium-sized business owner, we'll talk about what it may mean to your business. And then we'll talk a lot about what it means to your employees, or what it means to you as individuals of purchasing health insurance. And I think that's where the lion's share of the conversation will be, because it does very much impact individuals and provide individuals with some new choices. I'm going to remind you that many of the reforms, so the Affordable Care Act, has a bit of an extended implementation. So some of the healthcare reforms have already gone in place. The major change is happening right now, which is offering these plans on what's called the healthcare marketplace, or the public exchange, for this coming January. But other reforms have already gone in, and then there are other reforms that are set for years out, and I'll point that out to you here in a few minutes. I think, you compare this to deregulation in the energy business, that may be a very good analogy. I think it's amazing to me that there are probably thousands of conversations just like this with 20, 30 people in a room all over America today, because people are desperate to figure out, what does this mean, and what am I supposed to be doing as an individual or as a business owner. So that to me is just, is mind-boggling. And if you remind me, I'm not sure I have slides on this, but if you remind me, someone asked me if I had the opportunity to talk about the difference between defined contribution and defined benefits, and what that means in terms of coverage for their employees. I'll certainly get to that. And then, so I have this list. I'll get back to it. And then there's, I think there's a bit of a checklist you can go through as a business owner and as an individual in terms of the things you probably need to be considering in the near future. Okay, that's what I hope to cover. Does that sound like? Does it make sense, everybody? All right. Here's what we're going to do. So let me give you a little background on myself. I mentioned that I'm with Blue Cross Blue Shield. So I'm responsible for, I've been there 21 years, and I'm responsible for our relationships with employer group customers. So any customer that purchases Blue Cross in form of an employer is my responsibility. Joanne Wetzel, who is on the IMA board, works with me. Joanne handles some of our big customers, and so she might be able to help me if we get any tough questions. Sorry, Joanne, put you on the spot. But So what we do is today, health insurance is very much dominated by, it's provided by employer groups, right? When we look at the numbers of people that are covered, about 90% of people, generally speaking, if you exclude Medicare for a minute, get their coverage through their employer. And really only 10% of those that are covered today by individual health insurance products. Well, one of the things the law is doing is the law is changing that distribution, and it's creating avenues for those that don't have coverage today to get coverage tomorrow, meaning January 1st. And largely that will be individuals purchasing coverage. So with that said, the intent of the law, 2,000 pages, so we could probably all debate what the intent of the law was, but at a real high level, the intent of the law was to create a means for people that don't have insurance today to get insurance after January 1st. And so the intent of the law was, let's create some plans, mandate some things in those plans, and then also provide premium subsidies, so subsidies for individuals to actually offset the costs of the health insurance premium, and therefore more people would have coverage. So let's walk through that and we'll go from there. Any questions? Sound okay? All right, so the Affordable Care Act, I talked a little bit about how many of the things that are going on with the Affordable Care Act, some have already started, a lot are happening upon us right now, and some are in the future. So just quick reminder, a lot of press after the law was passed 3.5 years ago, that things started happening in the health insurance market right away. So things like covering dependents to the age 26. That's already in effect. So if you offer a health plan that happened, you have to provide certain levels of preventive services, so those have to be in the plan. And then we as health insurers are held to a medical loss ratio. And what that means, and it probably doesn't matter for you guys, but maybe it's just interesting at best, is that the law says that insurers have to pay out at least 80 or 85 cents on the dollar in terms of claims, that depending on which segment they're talking about. So if we're covering individuals, every dollar that comes in, we have to pay out at least 80 cents in terms of claims. We can keep the other 20 cents for, covering the cost of our employees, processing claims, building networks, holding on to some money for reserves to offset future claims. So the law mandates sort of what we, how we can manage our money. So that's important to us, so we obviously pay very close attention to that. But that's already in place. The reforms that are upon us right now, this is the big deal. This is what's mattering to America. This is what's on all the Sunday morning talk shows related to the politicians. This is what's happening, and that is the healthcare marketplace. So there's this thing called the public exchange, right? And I get people all the time that come up to me and say, hey, I've heard about this public exchange, and I've been walking around for like a year pretending like I know what it means. What is that? And don't tell anyone I asked you that. It's just an electronic place. It's just a website, a place where health insurance products sit so that people can purchase them. The government got onto this public exchange. It was an odd concept, and it wasn't resonating with people, so now they're asking everyone to call it the healthcare marketplace. So the healthcare marketplace and the public exchange are the same thing. This is the website where you can go and attempt to purchase insurance as an individual. So this is the major reform that's upon us right now. And so why is it such a it's complicated at best, right? So that's the public exchange is out there, and what comes with that, as you'll recall, is that individuals, Americans, have to buy health insurance or they pay a penalty. So there's an individual mandate. That's what went to the Supreme Court a year ago, and the Supreme Court upheld the law and said it is constitutional, and we can have a debate over break on how you feel about that. But the individual mandate is in place, so it's there. And I'll tell you what, it's very confusing because there are other taxes and penalties, and some of those have been either waived or delayed, but the individual mandate has not. So if you do not have coverage today, or your employees do not have coverage today, they are supposed to, under the law, buy coverage or pay a penalty. I'll show you the penalties. You guys probably know that the penalties are very small. So at least to start, year one, the penalties are small, but they go up pretty quickly. So as a business owner, you're probably going to want to think about that if you're interested in providing your employees some advice, right, in terms of some of the things that they should consider. Generally, we see that most employers offer coverage, and most of their employees have coverage, but it seems like everyone has some employees that don't have coverage, and it will be contemplating whether or not this individual mandate changes their mind in terms of buying insurance. So that goes into place. So the exchange, the individual mandate goes into place. Along with the exchange and the individual mandate becomes subsidies. The government is making subsidies available for people in certain income ranges to buy their individual health insurance. I'll hit on it right now. It'll come up several more times. So if you fall between 138% and 400% of the federal poverty level, and these are really terms that no one's really ever had to use in their life before, but if individuals fall between 138 and 400% of the federal poverty level, they will be eligible for a subsidy on the healthcare marketplace or the public exchange. So what that means is that's something like $34,000 to about $90,000 in terms of total household income. So we'll get back to that. The big issue that has allowed this to happen is that the law says health insurers can no longer deny people coverage. So if you apply for coverage, you have to accept them. That's called guaranteed issue. So you're guaranteed coverage if you apply. The reason that's significant is that employers, especially smaller employers, have contemplated whether or not they should offer group coverage in the past. And some of them, if it's purely an economic decision, have said, well, I can't drop the coverage because many of my employees will not be able to get coverage in the old world, right? Because they'd get denied. In the new world, the insurers cannot deny them coverage because of guaranteed issue. So the worry in terms of whether or not your employees would have access to coverage is no longer. Would we suggest that? No. And I'll talk a little bit about why as we get through the presentation. A couple other quick things. Benefits are mandated, so there's certain things that have to be covered. So there's minimum essential benefits, so the law says you have to cover these things. The law also says that preventive services have to be covered at 100%, so that the thought is that there's no economic barrier to people getting their annual checkup, their annual physical, that kind of thing. And then you've heard that insurers in the past had caps that you might hit a lifetime maximum and then you no longer have coverage. Those maximums are all gone. So a lot of what might have been considered barriers in the past are removed. So the intent of the law, I think, follows many of the things that I just talked about. So two other things that I want to hit on related to the reforms that are important, because as we get through the information, they help explain some of the law, and that is the large employers, over 50 employees, have to pay a penalty if they do not provide group health insurance. I'll get specific on that. That's been delayed a year. That was supposed to go in 2014, and there was recently the administration delayed that 1 year because it seemed that it was arduous on employers to figure out whether or not that penalty applied to them. It's an important economic part of healthcare reform. At some point, that penalty, right now the law says that the penalty will start in 2015. So the original law said 2014. It's been delayed a year. It's important because it's creating a lot of debate in Washington, and it's like I said, it's an important economic component to the law or the success of the Affordable Care Act. But the reason I bring it up is that I get a lot of questions, is how critical is it that I be either above or below 50 employees? Like, is that a big deal? We certainly wouldn't give anyone advice in terms of how you structure your employment, but right now that line has been drawn at 50, and if you have more than 50 employees, there will be penalties in 2015 if you don't provide either affordable coverage, good coverage, so adequate coverage as defined by the federal government, or you just don't provide coverage at all. And I'll explain what that means. And then Sometimes I hesitate to go into this point, but because sometimes it brings the conversation in a different direction, but I'll give it a try, is that the law also expanded the coverage of Medicaid. And half the time the audience tunes out because no one wants to hear about Medicaid, but just allow me 30 seconds on this. So Medicaid is for the poor, for those that didn't have access to coverage because they're very financially stressed, right? So the law, the old world said people are eligible for Medicaid if they fall anywhere from below 100% of the federal poverty level. That's what happens today. That's who gets on Medicaid today. The law, the federal law, the Affordable Care Act, expands that to 133%. So now there are more people that will be eligible for Medicaid. And usually these are not workers. So maybe they work a few hours a week for you, but usually they have very, very little income. The reason I bring it up is that it has pretty profound economic impact on just the whole healthcare space, if you think about it. So Medicaid is expanded. So the federal law said Medicaid is expanded to 133% of the federal poverty level. Then the president asked states, individual states, because Medicaid is actually delivered on a state level. It's funded by the federal government, but they give that money to the state, and the state manages it. And the president asked that states consider expanding Medicaid beyond 133%. And so some states, did what the president suggested, and some states did not. So lined up pretty much, red states, blue states, that kind of thing. But in the state of Illinois, where I presume your firm is, we have expanded Medicaid. So the state has taken Medicaid to 138% of the federal poverty level. So that's why I said earlier, the subsidies are available for those that fall between 138 and 400% of the federal poverty level. If you pay attention to the news shows, they will talk about 133 to 400% of the federal poverty level. Illinois expanded Medicaid a little bit. So what does that mean to you? Probably nothing other than it's an interesting factoid that our state took on a little bit more responsibility related to those that are eligible for Medicaid. For me, it's interesting because it's going to have economic pressure on the healthcare system. Medicaid does not pay a lot, so that means we as an insurer are going to have to work harder to figure out solutions because doctors and hospitals, in some regards, it's a zero-sum game, right? And if Medicaid is going to pay below their cost, if Medicare is going to pay at or below their cost, the private sector is going to have to figure out what the price point is and what we reimburse. So there have been some pressures that have been put on those of us that work in the healthcare system. So, all right. And then I'll just say this, there's some future market initiatives like the penalties I talked about. The individual mandate increases over time, and the employer penalty comes into play in 2015. It's a lot, right? Okay, take a breath. So we actually, I thought this would be interesting. We've been out talking about the Affordable Care Act. We actually have a community effort going on called Be Covered, and we took the Blue Cross and Blue Shield off of sort of that community outreach effort, and we've been out talking to individuals. We've been talking to individuals in communities that seem to have a high number of uninsured people, and we've been talking to them and saying, what's on your mind? And these are the things that are on their mind. I'll read them. Obviously, how does the Affordable Care Act apply to me? How do I figure out what I qualify for and what my options are? Et cetera. You can read these things. For those on Medicare, what does it mean? Are these new? We get this one a lot. Are these new health plans any good? When can I get insurance? Now, and I couldn't get it before, so there's some people that are anxious. How do I figure out what the best plan are? Which doctors and hospitals are in the network? And what if I don't do this in 2014, and will this be affordable? And the last question that we get a lot of is, I've never had health insurance before, so what does it mean to me? So these may or may not apply to your employees, but I think they give good context for figuring out how we sort of manage through the Affordable Care Act. So I'll just hit on some of these highlights, right? Does the Affordable Care Act apply to me? The answer is It applies to all U.S. citizens, right? And coverage includes those that are in an employer group, individual, et cetera. What I will tell you is that what people do ask, if I'm on Medicaid today or I'm on Medicare today, does this impact me? And those are the people that can breathe easy and you can say, no, it doesn't impact you. You can, whatever you're doing, if you're fine with that, it doesn't impact you. So my mom happens to be in the hospital, and I was over there yesterday. She's doing real well, but somebody in the hospital's got her convinced that the Affordable Care Act is changing her Medicare. And I said, Mom, it's not. I promise you. I've worked at Blue Cross 21 years. It is not changing what you have. So at least for those that have Medicare, it's easy to understand. So how do I figure out what my options are? So now we can kind of talk about, the what's going on, and that is people now, the enrollment period has started. So if you're interested in buying coverage as an individual or a small employer, the open enrollment period has opened, and you can go out to the healthcare marketplace. In the case of Illinois, it's the Illinois Health Insurance Marketplace, and you can log on and you can attempt to see what coverages are available to either individuals or small businesses. The reality is everyone knows, unless you've been on another planet, that that's not working very well. So this is being recorded, so be very careful. So here's the deal. This is what's happening. So the truth is that there's a lot of moving parts, as you could imagine, but at a real high level, there's information out there on premium rates, meaning what does it cost, right? So if I were to log on, my age, these are the plans I'm interested, what does it cost? You can get that information today. Coverages, what do these plans cover, right? So they cover, like I talked about, they cover preventive services at 100%, but they have coverage levels, which I'll get to in a little bit. You can get that information. The part that's having difficulty, that's getting all the news attention to say the website is moving slowly or isn't working, those news reports, that's all related to the third component, which is am I eligible for a subsidy as an individual? So today, if you were to go out to the Illinois Health Insurance Marketplace, you would be able to find those information on what it costs and what it covers. I don't know if you'd be one of the lucky ones that got through and were able to find out whether or not you got a subsidy. But if your family or your employee's family does not fall between 138% and 400% of the federal poverty level, if they know that their household income is, over $90,000, they don't need to find out if they're getting a subsidy. They're not getting a subsidy. But of the 1.8 million uninsured in the state of Illinois, a lot of them are subsidy eligible, so they can't finish that or figure that out until that sort of piece is working better. So that's healthcare.gov. So there's two ways you can access this information, well, three ways. You can go to our site, the Blue Cross site. We have all the information on our products and what it costs there, and we also actually have a seamless relationship with the federal site. Once that's working better, you can just stay there. But those are only our products. If you want to see everyone's products, those competing on the health insurance marketplace, there you either go to the Illinois Exchange, as it says up here, or you go to healthcare.gov. That's the federal site. So we happen to be, some of us were at a meeting yesterday, breakfast meeting, and Dick Durbin and John McCain were there, and obviously they got questions on the Affordable Care Act. And while neither of them were pleased that the rollout is complicated, they had hope that it would be working well by the 1st of November. That's what they said. So we'll see where that goes. So anyway, this is how you figure out if this is important or if you want to buy something on the exchange. So what I already said, that I'm on Medicare, what does it mean to me? It does not. It doesn't mean anything in terms of your Medicare coverage, but there are some people that have Medicare Part D, and that's the drug benefit that has a donut hole. It does change related to that. I'm going to move on. I doubt that's top of mind for this group. So A lot of people are hoping that these plans are good, but there's also some, I'd say, careful skepticism to say, are these plans good? And we can tell you we think our plans are really good, but here just at a high level, here's what's going on. So there's 10 broad categories for what the government called essential health benefits. So it said the plans that are offered have to cover these things, right? They don't have to cover them. They can decide at what level they cover them, but they at least have to have these things. So they have to have coverage for ER. They have to have coverage for the hospital. That seems obvious. Lab services, maternity, mental health and substance abuse. I'll pause on those. Those are the ones that in the past you might have been able to buy an insurance policy that didn't cover maternity or didn't cover mental health or behavioral health coverage. And that was, in our opinion, that was a consumer choice, right? If you wanted to buy a plan that didn't have those things, you should be able to do that. That was the old sort of marketplace. Now it's common. So those are always covered now. Pharmacy is covered, rehab services, I'll skip preventive for a second, but ambulatory and then pediatric care is also covered. So comprehensive coverage. So there shouldn't be a worry about whether or not these are good plans. The way the law was written, it defines the coverage levels. And then preventive, which is in the middle of the screen at the bottom, as I said, that was outlined in terms of what is preventive services and that it needs to be covered at a high level, 100%. Sure.
How do they relate? How does the coverage relate to, say, pre-ACA plan?
Yeah, so that's a great question. All right, so everybody hear that? So these coverages, how do these compare to plans that are in the marketplace today? And that, I'm afraid to tell you, is the challenge for business owners and challenge for individuals, because the coverages that are in place today, they're going to vary. Depends on what you bought or what your employer is providing. We have no guide that can tell you that the plans you have today compare to the silver plans on the exchange. So one of the things I'd tell you at a real high level is that business owners need to look at, if you're interested in considering a new approach to health insurance, right? One of the things you would do is compare costs, right? So how much do I pay today? How much would I pay tomorrow? And in order to do an effective evaluation of that, you need to also then compare the coverages, because it's easy to say tomorrow's is cheaper if the deductible is higher or if there's less coverage. So maybe you had a really, really rich plan today, and then you look at the silver plan on the exchange and they're not the same coverage. So the challenge, I wish I had an easy answer for you, the challenge for business owners is comparing apples to apples on those plan designs. Because premium cost isn't that hard to do. You can say, I'm paying $70,000 a month for my employees in terms of coverage. And if I choose this exchange plan, looks like I'm at $50,000, that sounds like a good thing. Coverages may not be apples to apples. I would encourage you to do one of a couple things. I think that the health insurance brokers, agents, consultants that are in the marketplace that almost all of you as businesses use to help purchase your insurance, I think they're an invaluable resource right now as you sort through all of these different options. I'm certainly not here to put on a commercial for them, but I know a lot of them, and there are a lot that are very, very helpful at the moment. Or pick up the phone and call your insurance carrier, and if it's us, we'll certainly walk you through the difference in terms of the plan you have today and the ones you'd be considering on exchange.
And your Blue Cross would be able to say your current plan has this and the new plan has that?
Yep, we will. So it's we'll be able to give you. Certainly be able to give you the obvious things, right? So shifting from your plan today, which has a $500 deductible, to something on exchange that's $1,000, those are easy. But we'll be able to get into some of the detail that might not be as obvious for you. So here are the things. I don't have a slide on this, but this is maybe the most important part of the day as a business owner, and that is you need to look at the cost, the premium cost. What am I paying today, and what would I be paying potentially tomorrow? Right? But then you have to try to normalize that for coverage to say, today my employees get this amount of coverage, and can we compare that to a plan that's similar in terms of coverage? So premium cost, coverage, those are the first two things that you need to have an evaluation on. Then there are two more that are really important in my opinion, and I get that these are really high level, but it's the reality of the world right now. Premium cost, coverage. The next is tax implications. So today, healthcare, group health insurance is tax deductible, right? And your employees contribute on your employees, take advantage of that, of the tax benefit for that as well. So consider that. And then the fourth is the most ambiguous and intangible. But as a business owner, I would suggest that depending on your business, you need to have a conversation with yourself to say, is group health insurance important to me? And when I talk to businesses, many of them say it is, and they break it down into two categories at a real high level. They say, it's important to me from an employee sort of recruitment or retainment perspective. And I get that we are in a state that has 10% unemployment. So the answer to that question today may be different than it was 10 years ago, and I hope it's different in a year from now, right? But that's a question that I think varies by business. And then the other thing is that I have conversations with employers. I have conversations with those that are sort of experts in the healthcare field. There's this question of whether or not you as an employer providing group health insurance, so providing a benefit to your employees, if that has any impact on the health of your employees. And if it does, meaning if your employees feel if they appreciate this benefit and they're more motivated to stay on top of their health, is that a good thing for you as an employer? And that's why I said this one is the one that's most intangible and ambiguous. But many people, myself included, believe that healthier employees are more productive, they're more present at work. And so as an employer, do you have the opportunity to maybe impact health, or at least some leverage on improved health if you're the one offering coverage? So I get that that's hard, but those are the things, if I was a business owner, those are the things be on my checklist, sort of the economic coverage, tax implication, and then is this a good thing? Does it help my business from an employment perspective? Question?
Would the size of the network be under covered, under how many doctors?
Yeah, so great question. So when we talk about coverage, absolutely. Be very, very, very careful to do an evaluation. So today, most employers today, not all, but many, many employers buy coverage that has a pretty wide network of doctors and hospitals that would be considered in network. That, everybody might have a little bit of a different story in this room, but that's largely what employers buy today. If you think about it, employers are buying on behalf of not just themselves, they're buying on behalf of, a small employer might be buying on behalf of 25 associates, a large employer might be, buying on behalf of 250 or 500 associates. And so that it's been easier to make a decision. If that person who makes the healthcare purchasing decision, it's been easier to say, let's make a broad decision so that more docs and hospitals are in the network. It should make more people happy. So that's what a lot of people have today. When you're comparing to these exchange options, there are many plans that have a more select network of doctors and hospitals. And the reason is that many insurers were trying to figure out, they were guessing on where the marketplace had to be in terms of cost, right? So in order for an individual or a small group to consider purchasing in this new marketplace, they had to guess on cost. So some of the insurers decided to have a more select network of doctors and hospitals, and then that impacts price, right? So they may have been able to put a more favorable price on their insurance product if they had a more select network of doctors and hospitals. Quick commercial for us. For Blue Cross and Blue Shield, you'll find both select, more select networks, but you'll also find our broad-based networks out there. So you'll see many, many options out on exchange in terms of the networks we offer. And so it's a great question, and just to repeat it, when you look at coverage, is which doctors and hospitals are included, does that fall into my evaluation of coverage? And the answer is yes. And that's the thing that has sort of immediate impact on price. Okay, so when can I get coverage? That's easy. So this is, again, for those that don't have coverage today, they can get it on January 1st. Let me talk about the plans. We just got into this a little bit a second ago. So the law tried to normalize things in terms of coverages. I talked about those 10 essential health benefits. They were kind of obvious, right? ER, hospital, pharmacy, you heard all that. Then the plan said, the Affordable Care Act said, let's categorize sort of the richness of the plans that are going to be out on the exchange to help consumers and small businesses understand which ones might be best for them. So they've come up with 4 categories. They decided to do it by metallics. And so what the law says is that there are platinum plans. Those are the richest. Those are the ones that have the most coverage. Gold, silver, and bronze. You get it, right? So if you went out to the exchange today and you looked at that stuff that I told you is working, which is the coverage levels and the cost, they all fall into one of these 4 metallics. So if you as an employer, back to the gentleman's question in the middle of the room, if you and an employer are offering rich coverage today and you want to compare a rich kind of plan to a rich plan on the exchange, you should look at platinum or gold, right? And let me tell you how this works. The law says that insurers need to put out plans that fall into these 4 categories, and these 4 categories are defined as when we do an expected claim cost, meaning the insurer pays, to how much the individual would pay, it's at the actuarial value. It says that the platinum plans are aimed at paying about 90% of claims, and that the member is responsible for about 10%. That's the goal of that plan, right? The combination of the deductibles and the co-shares, co-pays, co-insurance are 10%. The plan, generally speaking, pays the rest. So if you believe that, if you understand that concept, it goes platinum at 90%, gold at 80, silver at 70, bronze at 60. So that's the idea. Many economists in Washington, sorry for a little bit of a sidebar here, but many economists in Washington believe that today's system, that people buy too much coverage, or their employer buys too much coverage on their behalf. I don't have an opinion on this, but one of the things that some of the economists thought is that when individuals had choice, that maybe they wouldn't buy as rich a coverage as their employer provides them today. Again, I don't have an opinion on this. I believe that individuals should make that decision in terms of what's right for them, in terms of what they can afford, what their sort of risk tolerance is, et cetera. But that's how they line up. And when you're comparing, it'll be fairly obvious that the richer plans, the ones that cover more, fall into platinum. And they're more expensive because, right, they're covering more services, so they're going to command a higher premium. Almost all of the conversation, if you read the newspaper or listen to any of the talk shows, almost all of the conversation revolves around the silver plan. That's what the experts believe is going to be the most popular plan, and it's also the plan that the subsidies are targeted off of. So for all of those individuals that fall into that big range of 138 to 400% of the federal poverty level, the subsidies are targeted off one of the silver plans. Technically, it's the second lowest silver plan. So the more detail than we need, but the subsidies are targeted off the silver plan. 2 things you need to know about the silver plan. So that's part of the reason they're getting all of the talk, and they do think, a lot of people think they'll be the most popular in terms of choice. I think I have a slide on the next point, so I'll say this about the silver plan. I think it comes up in a few minutes. So you can buy, so if you're subsidy eligible, your subsidy is targeted at the silver plan, but you could choose to buy down to bronze. And we think in some instances people could get a very, very close to free coverage if they were interested in taking bronze, which means you take on some risk because the deductibles and coinsurance are higher, but the combination of their premium subsidy and then the cost of the bronze plan get really close. So some individuals, if they actually get through all of the confusion on this, might find a very low cost option after their subsidy. Does that make sense? So the other thing I'll tell you is that the law was concerned, and rightfully so, it was concerned that some people would not be able to pay their deductibles and their coinsurance. So there is, in addition to the premium subsidies, so that's just money that the government is making available to offset your premiums, there is also a co-share or a coinsurance subsidy. So if you, as an individual, fall below 250% of the federal poverty level, you may be eligible for both the premium subsidy and a coinsurance subsidy. So, but the things that people need to know and the advice that we're giving to people is that a couple things. Number one, you only get your subsidy if you buy on the exchange. The government is saying your subsidy is only available if you buy products on the exchange. No questions asked. This coinsurance subsidy, to offset your deductibles and coinsurance, if you fall in that 250% or lower, that only applies to the silver plan. So they're not available if you purchase another plan. So reasons, I could speculate, but we don't have time for that. Good question a minute ago is, do the network of doctors and hospitals vary? They do. Pay attention to that. Here's the individual mandate. So much was made of this. If you paid attention when it went to the Supreme Court, the individual mandate, which, as I talked about at the beginning, says individuals have to buy coverage. If they don't buy coverage, they pay a penalty. Here are the penalties. I'm not sure how well you can read it, but in 2014, it's either 1% of your taxable income or $95. That doesn't sound like a lot of money. Whichever is greater. It goes up, though. You can see, let's just jump to 2016. It's 2.5% of your taxable income or $695. So year one, probably not significant in terms of in terms of if you just look at what that costs may be, but it does go up. So this is what the individual mandate is, and I think there's been quite a bit of confusion, around this. I talked a little bit about will it be affordable? I think that's an individual choice, but there's I talked about the tax credits to help pay for premiums, and then there's also cost sharing for low-income individuals. And this we've already covered as well. Who gets these subsidies, right? 400% of the federal poverty or below, and then in the case of the cost sharing, 250% or below. So my estimation, I'm going to go back to my list, is that there's just, a lot of chaos right now. People are trying to figure out what they should and shouldn't do. And so in addition to individuals, let me grab something. Individuals getting premium subsidies or premium tax credits or the co-insurance subsidies, small businesses that purchase on exchange are eligible for tax credits. And so today, you buy health insurance and you get tax deductibility for that today. There are premium, there's a small business healthcare tax that you may qualify if you purchase, a small group plan on exchange. So if you fall into that, so if you're a small group, which means less than 50 employees, today that's how it's defined, you should, that question on which has more tax benefit to you, the current system that's tax deductible and your employees pay with pre-tax dollars, or the premium tax credit that's available to small businesses, is something that you have to evaluate. So I talked about premium and then the tax implications. So I would tell you that the definition of the small group or small employer tax credit is confusing. It's not something that we're experts on, but there are some high-level rules around it. You got to look into it soon, because they're saying there are time frames in order to apply for the small business healthcare tax credit. That's what it's called, small business healthcare tax credit. And then there are some rules around how you're eligible for it. And when you talk to either your broker, health insurance broker, agent, or maybe your tax professional would be a better place to go for this. There are some rules about a minimum number of your employees have to buy the insurance, have to actually want to be on the plan that you purchase, right? And there's rules around how 70% of your employees need to purchase that plan. So what you do is you buy a small group health insurance plan. You're 10 employees, right? You need to make sure that you have 7 employees that actually follow through and take that coverage. The law has some minimum requirements. So I'd look into that. That'd be my advice. If we were tax professionals, I would share the information with you right now, but we're not. But those are on your checklist of things to keep in mind. That's how, if you're a small business, there is an opportunity for a small business healthcare tax credit. If you're a larger business, there may not be, and so your decision on whether or not there are tax benefits may be easier, right? The current system may be the only way you get tax benefits depending on your size. So just wanted to share those with you. All of that information is online, and while anything related to tax is complicated and kind of gives me a headache and puts me to sleep, that information is all online. You can get that. So that you don't have to wait for the parts of the site that are having delays or difficulty to be working. You can get all that information right now. So let me hit on a few other things, and then we'll kind of get to some questions. How's that? So a lot of people ask me, so now kind of shifting away from the specifics of the Affordable Care Act to just the realities of the marketplace. There is mass confusion, right? People are told that there's this marketplace, but they don't know what they're supposed to buy or how they're supposed to buy it. So I was telling someone this story, and one of the gentlemen that works with me, he thought it would be a good idea if we put a picture of Calcutta, the Grand Bazaar in Calcutta, as the metaphor for chaos, sort of in the marketplace. But here's some of the reasons why the Affordable Care Act is upon us, why healthcare costs are high. I'll talk about it a little bit, and then I'm going to get back to some of the points that I talked about at the very beginning. So you may know that medical inflation is outpacing CPI. It's outpacing probably any of the other costs that your business incurs. It's outpacing, generally speaking, it's outpacing anything you can do to raise the cost of the goods you're selling. So that's a problem. That's not sustainable. It's been running in the 6 to 8% a year for a long time. I don't know. 10 years, right? So that's just not sustainable. So what's driving that? A lot of things. It's not just what we have on the slide here, but these are a few examples. The aging population, right? So people are getting older. People are living longer, right? Medical technology is getting better, so that's great, but medical technology is expensive, so that goes into the system. And then the Affordable Care Act is not, it wouldn't be a reason that we would say prices are going up, but the Affordable Care Act has, what I would say, shined a spotlight on all those things that I just said, that the cost of healthcare is too much. It's actually, the inflation around healthcare is too high. Things like the utilization, how many times we consume certain healthcare may not be optimal. So I really believe one of the great things about the Affordable Care Act is it has sort of shined the national spotlight on the cost of health care is too much and we need to do something about it, or the system is not sustainable. So I personally think it's a great thing. I think it will breed new ideas. It'll breed solutions for all of us down the road. It's also very complicated because I always have one of these conversations and someone says, wow, is everyone worried that now the baby boomers are finally aging to where they're going to need, more health care? And at the same time, it would seem like the numbers of doctors and nurses that are retiring are probably fall into the baby boomer category too. So is anybody worried about this, sort of increase of demand on the health care space and the reduction in terms of supply? Like, is that worrying anyone? It worries me. I don't have a good answer for it, but I didn't think we could have a conversation without talking about it. So that's the stat, in case you're curious. Started at the 1st of 2011, and over the next 19 years, 10,000 baby boomers hit the age of 65 per month. So a lot of people going into the system. The Affordable Care Act, just high-level stuff again. Affordable Care Act does expand access, so more people will be in the healthcare system. So it'll be interesting for us to watch how that stresses the current healthcare system, what that means to us as employers. I think everyone feels a responsibility to make sure that their employees have access to good coverage, and there's more ways to do that now than ever before. But no doubt, one of the things that the Affordable Care Act is remarkably successful at is expanding access. More people will have access to health insurance, and therefore they'll have more access to maybe mainstream coverage that they didn't have access to before. The Affordable Care Act talks a little bit about improving cost and a little bit about improving quality. You probably don't want to hear too much from me on that. So I said I'd hit on a couple things, a couple terms that you hear about and that were mentioned to me over coffee this morning. So there's this idea of defined contribution versus and defined benefit. Let me tell you what those terms mean. They may or may not mean they may mean something to your business. So today, if you're providing group health insurance to your employees, that's what's called defined benefit, right? You're defining the benefit that you're purchasing on behalf of your employees. A really good thing. In the retirement world, most employers, if they offer some type of retirement benefit, they're generally in the defined contribution world, where they said, here, I'm giving you some money to put in an account. You decide how you want to invest it. I'm just defining the contribution. So those terms, defined benefit and defined contribution, if you put them in terms of the employer, right? I'm either defining the benefit or I'm defining the contribution, then they make sense. If you just use them like everyone else, they don't make any sense, and people pretend like they know what you're talking about, but they don't. So with the advent of many of the things we've talked about here, that is, rising costs, a new marketplace that's available to buy health insurance, this idea of health care or health insurance moving from defined benefit to defined contribution is upon us. And lots of employers are talking about, does it make more sense for me to just define a contribution? Today I pay $8,000 in healthcare expenses for every one of my employees. Making that up, may not be too far off. $8,000, and tomorrow I'm going to provide that $8,000 to them and tell them they can go buy their health insurance. You need to put, kind of programs and systems around that, but that is a concept that many employers are contemplating. A few real large employers have hit the headlines because they've said that they are moving in this direction for some segment of their employee base. So it's still very, very early in this space, but the idea of defined contribution is being seriously debated and tested in health insurance now. And for those of us that have been in the business, and there's a few of us in the room, it's been talked about for 20 years, and it's finally, being tested a little bit. But that's the concept that, and you may have that same debate, right, as you think about what's best for your employees. That very much becomes a math exercise, and the one thing I would tell you is both the good news and bad news. Is the good news is you can define your contribution and say, I'm paying $8,000 today, and then when we wake up in 2015, you may still pay $8,000. In 2016, you may still pay $8,000. And so that's the good news. And the bad news is that if healthcare inflation doesn't come down to a level in line with something like CPI, your employees are going to, the increase on healthcare costs gets shifted from the employer to potentially the employee, right? Because the employee's still getting $8,000, but the cost of healthcare, went up by something. So their responsibility may grow. So those are the behind-the-scenes things related to defined contribution versus defined benefit. And then I'll talk a little bit about. There are fees that the Affordable Care Act, taxes and fees that need to be paid in form of your health insurance premiums. So if you're a small employer, your health insurance company will line item fees and taxes related to the Affordable Care Act that will now be part of your premiums. So that's just a reality. There's some funding of the Affordable Care Act through taxes and fees. And if you're a larger employer, depending on how large you are, the insurer may not do that for you. You may be responsible for paying those taxes and fees related to the Affordable Care Act directly to the federal government outside your health insurance premiums. So if you think that applies to you, let me know and we can talk. I thought I'd leave you with one example. And then I'm going to open this up to questions. I'll double check my notes there to see if I've missed anything. But a lot of people ask me, what do these plans cost on the exchange? So a couple things. The way health insurers can come up with rates on health insurance has changed. We used to be able to decide if we wanted to rate based on gender, right? We could. Now you can no longer rate on gender. So we can't, a male and a female, we have to offer the same premium to. We can rate on age, so we can still rate on age, but the law says that we need to, insurers need to compress the variety of rate, or the variability of rates within age bands. So today the marketplace has said, in the open competitive marketplace, it is said that the range in terms of what you pay for health insurance ranges about 5 or 6 to 1, a ratio of 5 to 6 to 1. So younger person might pay 5 or 6 times less than somebody on the older end of the spectrum. The law, and that wasn't really regulated, right? That was just the health insurance marketplace coming up with what they thought people would buy and pay for and what was appropriate for insurance risk. The law says that ratio can't be beyond 3 to 1. So what that means is that between your sort of best rate and your worst rate for that across the ages, the max gap is 3 times. With that said, that doesn't mean it costs less for health insurance. It just means the age bands get compressed. So someone's going to benefit from that compression, and someone's probably not going to benefit from that compression, meaning old world versus new world. So you could see a scenario where someone on the older end of the spectrum as more favorable rates. Someone on the lower end of the spectrum, their rates may be coming up because of that 3-to-1 compression. But here's an example, the silver plan. Here's an idea. I think this was a 27-year-old on the right, and I think this was a 59-year-old on the left. I'm pretty close on that, but you'll see an idea for individual coverage. We saw that that there was a plan out there that was $172 a month for the younger coverage, but the range was anywhere between $172 all the way up to $314. So to the gentleman's point earlier in the question about network, that's probably largely the variety, that maybe the $172 is probably the most efficient health insurer in the marketplace, and it's also likely maybe a more select network. But on that silver plan, when I looked at it for this age group, there had to be 15, 20 choices of plans that were available across that spectrum, and again ranged from the $172 to $314. Get a little older, there's the the lowest cost plan was $419, and it ranged up to almost $800 in terms of all of those across the spectrum. So hopefully that's interesting. There are a lot of things that drive cost. I think what would be a good idea is if I had a couple slides in there on ways we're trying to improve cost, but I feel like I've been talking a lot, and I thought I'd pause and see where we're at in terms of questions. I'd love some questions or some friendly debate. Go ahead.
What's it going to affect, like right now I have coverage for so many of my employees that we signed up until next August. Am I going to see a huge increase from next August?
Yeah. Okay, good question. So you have a plan, and it takes you through some portion of 2014, whether it's, in your example, it's August. There are probably variety in the room. The Affordable Care Act would not be the reason that you might see cost increases next year. So you've been buying health insurance, right? And some years you were part of the pool that did well, and in some years you were part of the pool that didn't do so well, or there was volatility in terms of healthcare inflation. So I don't think you should assume that prices are going up on your renewal. I don't think that at all, especially if you're a small business today. I think it's more of the traditional issues related to what's the risk pool like and what's medical inflation going to run at. So I know it sounds like I'm giving you a vague answer. What I would encourage you to do, anybody that has a group health insurance plan today, many of you have already done this, is I would work with your broker or your agent, and I'm not trying to, kind of punt that off. You're welcome to call us, but I'm telling you, they're really helpful right now. And a lot of businesses are looking at, I'm in a plan today, and should I consider a plan that starts January 1st? So should I buy one that's sort of the Affordable Act compatible? Or should I buy one, should I stay on my current plan year? Or should I consider one that has a different anniversary date, maybe November or December 1st? And most insurers, depending on who you're currently with, are offering options right now to say, here, there's a bunch of stuff about to happen. So in our case, what we're doing is for small groups. For small groups, we are issuing a renewal that would tell you, here are potentially three options. Here's an option to keep your coverage in your case, on the August 1st. You already know what that is, so current. We will show you if you want to renew on December 1st, so change your anniversary date from August to December and sign up for sort of an annual plan that would go from December to December. We're providing that option for you. And then we're providing a third option, which is if you want to move to January 1st, which is sort of in line with all these ACA compliant, the Affordable Care Act compliant programs. So if your plan is with us, I'd encourage you to do that, and that's a quick phone call either directly to us or to your agent or broker, and we'll make sure you have those 3 options. But it wouldn't be fair I know your real question was, at the end of this, are my premiums going up? I honestly can't predict. I think that there are going to be, looks like there's a lot of cost going into the system, but we also hope there's a lot of good risk going into the system in terms of people that didn't have coverage. So the intent of the law, if the intent of the law prevails, right? So if this website gets fixed and the intent of the law prevails and that people get coverage that didn't have coverage before, and that is a reasonable risk pool, that could actually help the overall economic kind of, the entire sort of cost of healthcare. Time will tell. So I think this renewal option, we sat down with the Department of Insurance and let them know that we were going to give these multiple, sort of group renewals out completely under the premise of consumer choice. We want small businesses to have choice, and right now they're very confused. They should be. We're confused, and so they were in favor of us doing that, meaning pushing out those renewals to your health insurance plans with those up to 3 options. The only reason it wouldn't be 3 options is if you're already on a January 1st. If your policy is January 1st, one of those options, those are combined, right? You now only have 2 options. We could look at changing your anniversary date to December or staying with current, which is January. Another question?
Yeah, I got a question, actually a couple of questions. One, as it pertains to the individual, and maybe you can tell me if it's true or not. There was a lot of talk, a lot of people thought that this act would actually allow the individual who already has coverage, maybe their employer, to actually also be able to have choice.
Right.
In terms of going into the marketplace.
Yeah.
And it appears, from what I've seen, that if you are with a company that's already offering coverage, that if you was to go in the marketplace, then you would not be eligible for subsidy. And as a result of that, you'll find out that you're probably better off with your company, because without the subsidy, the marketplace would tend to be higher.
You should come take this. So that's a really, you're right, but I'm going to repeat it so everybody understands it, okay? So today, lots of people, whether you have, your example is today there are lots of people that are working and have insurance through their work, and they've heard all about this, and they've been saying, am I going to be better off buying these health insurance plans that are on the exchange as opposed to buying my employer plan? Because today I pay something, generally speaking, out of my paycheck for this group health insurance plan that my employer buys on my behalf, right? And employees, you guys all, most of you in this room have employees, and while they think they're paying a lot, you're paying, for every $1 they're paying, you're paying 8, right, or something like that. So one good thing about the Affordable Care Act, as I said, that spotlight is even helping employees understand their employer is spending a lot of dough on their behalf, which is a nice thing. So here's how it works. So the question, very intuitive question is, do those employees that have coverage today through their employer, can they buy on the exchange, right? And the answer is, what the Affordable Care Act and what the government would tell you is that yes, they can. They can buy on the exchange. But that's not the real question. The real question is, do they have access to subsidies? And it goes like this. The intent of the law was to provide more coverage to people that didn't have it today, or new coverage to people that had bad coverage, let's just say, or coverage to people that had unaffordable coverage today. So I'm going to break that down. So the law says that if you have group health insurance coverage today, your employer provides you this coverage, right? And if that coverage is deemed good coverage, right? So the government says that is an acceptable plan. It's a qualified plan. It covers enough stuff, so it's good coverage. If it is good coverage, and if your employer, so you as a business owner, You make a decision on how much you're going to pay on behalf of your employee and how much the employee is going to pay, right? In terms of their employee contribution. The law says that if you as an employee do not pay more than 9.5% of your income, meaning how much comes out of your check, if it's less than 9.5% of your income, then it's affordable. Your employer is not charging you too much. So if those things happen, you have group coverage, it's good coverage, it's deemed qualified coverage, and it's affordable, it doesn't cost you more than 9.5% of your income, you are not subsidy eligible. So that's the decision tree that the law has, and that is guidance I would suggest you give to your employees. So when you're thinking about the things that you tell your employees, that's one of the things that I think if you've decided you're going to keep group coverage, which, boy oh boy, and I don't want to speak for everybody, but the overwhelming majority seem to be keeping group coverage if they have, what they deem good group coverage. Sorry. I'm one of the last people on the planet that sells a BlackBerry. And I swear the button that says silent shouldn't mean the phone also rings. So that would be one of the things I'd suggest that you talk to your employees about, that here's who's eligible for a subsidy, right? At a high level, it's those that fall between those income ranges that I said, but also you need to understand if you're afforded group coverage and it's a good plan and it's not more than 9.5% of your income, then you won't have access to subsidies. And I don't think and again, I just go back to the intent of the law. The intent of the law was to provide coverage to those that don't have it today, or it's not affordable, or isn't good coverage. And the law had to define something. They picked 9.5%. They may have made a decision on what qualified health plans are, and your insurer can tell you if that's a qualified health plan. So good question. So those employees that are contemplating it right now may or may not be eligible for subsidies.
Is there a possibility that your employer plan is a good plan, maybe platinum plan, you're providing so that they don't have to pay over 9.5% of their income, but then if they look at the exchange even without a subsidy, maybe that bronze plan is cheaper, and now you're not at 70% participation rate for your group plan, and you're not going to get, and you get the fine, or you don't get the subsidy, the small business subsidy?
Yes, I mean there is a chance. So that
the employer maybe can't provide that platinum coverage anymore. They need to consider a bronze plan as well to make sure people stay with a group plan.
That's what a lot of plans are doing, are saying, do I need to have, we've traditionally provided, bronze is really, really, really rich. There's not a lot of bronze offerings, platinum. But a lot of employers are taking a look at the plans that they offer and say, here, we've traditionally provided this kind of coverage. We want to keep doing that, but maybe we need to offer this is off exchange, so I want to stay in the world where I just buy group coverage, right? If that's for you, that they're putting in their mix maybe an option, a rich option, and maybe something with a higher deductible. Maybe not all the way to bronze, because bronze does shift a lot of the risk, but a higher deductible plan for those that are interested in paying less and offering and taking on a little more risk themselves. So we're seeing a lot of that. You're just in a point of clarification, that's 70%. So that's if you as a small employer decide to buy on exchange, because you can buy small group on exchange, that the premium tax benefit, you're eligible for it as long as and again, you're not taking tax advice from me, right? As long as 70% of your employees actually take the plan that you've offered. You need to talk to your tax professional about if you stay off exchange, because today it's your health care is tax deductible. That doesn't change. My understanding is, let's just say you stay off exchange, right? And you have 20 employees, and if only 6 of them take the health insurance and you're off exchange, you still get tax benefit for whatever health care you're buying. Because that's just part of today's normal tax code. And the tax implications that have changed are there some defined under the Affordable Care Act. So I hear what you're...
So there's no fine as long as they don't have to contribute more than 9.5%. There's no fine no matter how many of them participate or don't participate.
So today...
They're only liable for the fine if it's unaffordable.
All right, so today, just to be clear, if you're less than 50 employees, there's no fine, right? The fine starts at 51 employees in 2015, okay? The issue around, so two categories. One, if you buy on exchange, if you decide that you want to buy small group coverage on exchange, you can apply for a tax credit on exchange, and you should work with your tax professional, but there's something in that says that if less than 70% of your employees take it, you may not be eligible for that tax credit. That's if you buy on exchange. If you stay in the current world and you're off exchange, today the world says, listen, no matter how much health care you buy, there's some tax benefits. So whether you buy, whether you pay $20,000 a month or $250,000 a month because that's how many people in your plan, you get some tax benefits for that. That doesn't change. It'll be interesting, though, over time to see how these two sort of, tax deductibility of group health insurance, how they, combine over time. So, and then as far as the penalties go, if you're over 50 employees. So it was interesting, even yesterday, John McCain, asked for a show of hands and said, does anyone know who picked 50 employees? But that's the number. If you're over 50 employees and you do, let's say you provide health insurance, but it costs your employee more than 9.5%, then you do pay a penalty for that, and there is a penalty amount for that individual that you pay as an employer.
And you also define if you drop it.
Right. So if you're over 50 employees, and let's just say we fast forward and we're in 2015, you just say, I'm not providing group health insurance, then you do pay there's a fee as defined by the Affordable Care Act that you pay on a per employee amount.
Is the 9.5% a simple calculation of just the premium dollars to gross wages?
It is.
Or like total medical expenditures, like a risk, like expected risk?
No, it's not. That's the only one that is a little more clear. It's the 9.5% to their actual. I think it's not their household income, which is what the subsidy is targeted on, which is complicated because employers don't even know that because you only know what you pay them. But it is, I think it's their adjusted gross income. That's the one that is more straightforward. Jeff?
A friend of mine is 55, his wife has a pre-existing condition, he's currently on an individual policy, he's a consultant, he's doing very well financially. He's in the Illinois CHIP program, pre-X. So he's looking at 2014 as being very favorable for him because I think he's the one who will benefit from this Affordable Care Act. He's been struggling to get on the Healthcare Gov site.
Yeah.
But he's not eligible for a subsidy because financially he's doing very well. So my recommendation to him will probably be forget the government site, just go to the Blue Cross site because he's going to get the same coverage whether he's on Healthcare Gov or on your site, correct?
Absolutely correct. So someone there are people that buy individual insurance today, and it's a smaller number. But in this case, in the case that Jeff outlined, it's someone that has reason that needs health care today, and so in the past they would either apply for individual coverage and likely get denied, or they'd apply for a government-funded program, which Jeff just mentioned, the iChip program, and in this case they got in, so they had coverage. So for people that need health care, can afford it, and are not subsidy eligible, they don't need to wait for healthcare.gov because the benefit of the information on healthcare.gov is the information around subsidies. So They can go to one of two places, I'd tell you, Jeff. They can go to ours, which we think are the best plans and the most affordable plans, or they can go to the Illinois site, because the Illinois site is working in terms of that piece of information, coverages and what it costs. You just can't get the subsidy information. But if they go to our site, not to be a commercial for us, if they go to our site, they can do it all at once and enroll all at the same time too. Say, yes, I want it, enroll, and they're done.
Given that pre-existing conditions are no longer considered, will Jeff's friend get the same rate as, say, a small employer or a large employer?
Jeff's friend is purchasing individual coverage. So they would get the same rate as another individual that falls into their same profile, even though they have a pre-existing condition, right? So the risk pools are individual coverage. So those that buy as individuals, yes, they would get the same rate as someone else who fell into that same profile, right? But an employer is still purchasing on behalf of more than one, right? Not an individual, somewhere between 2 and 50. So really hard to compare the prices over here on group and the prices on individual, because they're very different, But when we look at it and we normalize it, the prices are very close, right? We adjust for some level of difference in those pools, right? At the very beginning, I told you the government said that we have to have either an 80 or an 85%, loss ratio, 80% over here, 85% over here. So it would be very hard for you to point out the differences in Jeff's example and say someone within your group plan.
So the small group plan could not take into account pre-existing conditions, but it could still take into account, say, the age of the group?
Yeah, correct. Exactly. So nobody's taking pre-existing conditions into consideration anymore. And actually, it's been a little bit overplayed, because pre-existing condition has been gone in group coverage for a long time. No insurer has been able to exclude things for pre-existing conditions. It's real, but the individual market, those that bought one policy at a time, you could exclude or you could deny someone coverage for pre-existing condition. So it's gone in that space. So now it's gone everywhere, I guess.
Let's say my friend was a risk taker, a gambler, and he said, well, all right, in 2014, I'm not going to pay health insurance because my wife is okay for now. But let's say, so he dropped coverage entirely, paid the $95, and then let's say she went to the doctor in June of next year, and the doc said, yeah, we're probably going to see something come up in July, and we need some treatment. Could he go buy insurance in July and select against the marketplace and, buy it like the house is on fire, so now I need insurance?
Yeah.
I mean,
So yeah, that's
the downside of this thing, right?
yeah. Well, so unless they have so great question, and all of the debate said that who would buy health? Those that don't have health insurance today and don't think they need it, who would buy it? Who wouldn't just pay the $95 penalty? Well, there's been clarification in the law that you need to wait for the next open enrollment period to buy. So here's what, and I think we need to do a better job of getting the word out as an industry, and maybe this falls to our responsibility, but that's the risk, that if you don't buy insurance and you do have a significant, healthcare issue, you would be responsible for that amount of money. You'd have to figure it out. So we think it's dangerous for people. We don't think people should just weigh that $95 versus the premium cost. If they need health care throughout the year, which very good example, they would not be able to get coverage. The way people can get coverage is if there was a qualifying event, and getting sick is not a qualifying event. But so if you If your employer drops coverage, that's a qualifying event, and you can go buy the exchange product. If you, things like divorce, things that have transpired where you no longer have group coverage are qualifying events. So the exchange will be selling insurance throughout the year, but the open enrollment period is only for in the fall. Well, this year it's going longer. They're putting a tail into the spring because they know it'll take longer. And that's for January 1st. So I think that, Jeff, you bring up a great point. That's the one of the confusing points and one of the myths about this is that people should just sit around and then buy insurance when they need it. They could get caught in the middle, and we think that could be a financial disaster for some people. And doctors and hospitals, just a little bit off topic, doctors and hospitals are asking us lots of questions now. Even though the law was passed 3.5 years ago, they're saying for the people that buy the bronze plan, who's going to go find that money, the $5,000 deductible or the 20% coinsurance? The doctors and hospitals are saying, are we going to have to, we liked it when Blue Cross paid all the bills. Are we more in the collection business? And then they're asking Jeff's question. How does it work if someone has no coverage and they're in an accident or they have an unexpected healthcare situation? So people are now, now that this is upon us, people are asking those questions. And as far as the first one, for example, in the bronze with the higher deductible, the law defined it. The law is what said that here's how much the bronze had to cover, here's how much the silver had to cover. That was not the insurers. So really, really good point. Advice to friends would be, the kitchen table economics, right, are not $95 versus the cost of premium, the monthly premium cost. The kitchen table economics are the $95 penalty, the cost of the premium, and what your expected healthcare spend is going to be that year. And some of us have a good idea. They know, you take a couple prescriptions throughout the year, you get your kids to the doctor, but there is certainly the unknown that people can't predict, right?
You talk about the Cadillac plan tax and how that, you're kind of talking about evaluating your current plan to the marketplace and what that would be theoretically, evaluating your plan or goal. And go into the Cadillac plan tax, where did that come up?
Okay. So there's been this talk, if you've heard some of the headlines, there's been this talk of a Cadillac tax, meaning employers. So I talked a little bit about in 2015, employers over 50 employees could have to pay penalties, right? If they don't comply with the law. So if they drop coverage, if they don't provide affordable coverage. There's another penalty that kicks in 2017. It's either 2017 or 2018, called the Cadillac tax. And what it says is that as an employer, if you provide coverage that is really rich, so they've picked a rich plan today, and then they've looked at it and said, here's what it would cost, 4 years out, or 3 or 4 years out in 2017 or 18, and if it exceeds this amount, you as the employer owe additional penalties. So if you're a large employer, so if you're over 50, I would encourage you to sit down with someone and think about whether or not you can make changes to that plan to make sure you avoid the Cadillac tax in 2017. Because the value of the healthcare plan that you're providing is going to go up exponentially if you do nothing, right? If you do nothing, it's going to go up 7 or 8% every year. So the evaluation of your plan could go up 35% between now and 2017, and that could trigger you to be in above the amount that the Cadillac tax says, or where the Cadillac tax goes into effect. I would tell you this. So I was at a seminar like this, and there was an economist who raised his hand and said, I was involved in helping define the Affordable Care Act, and so I asked him the question about the Cadillac tax, and I said, that seems penalizing. If employers want to provide rich coverage to their employees, and they're in a business that is doing well, why can't they spend their money how they want to spend it without being penalized? His opinion as an economist was that we need triggers in the system to lower the amount of coverage, that people are overinsured. I don't know if, I certainly don't have an opinion on this, that people are overinsured. And I said, well, okay, well, why do you care? And he said, because the system, when we have too many people that are overinsured, we don't believe the system allows for people to be involved in making decisions around cost and quality of healthcare. So if everything is always covered, right? The thought is that you don't care if the MRI is $2,800 or $900 as a consumer. So normal economic forces that we see in other things, probably in the things you guys make and sell, you see normal consumer economic forces sometimes don't prevail in healthcare. And some people's theory is that because they're just at a macro level, people are overinsured. So I can't give you the specific numbers of the Cadillac tax because it's been so heavily debated, and I didn't bring any of those notes. But if you're over 50 employees and you have group health insurance today, sit down with your broker or agent or us and figure out if you're on a trajectory to be above the Cadillac tax and what it means to you, because it is significant. The numbers. People are going to absolutely try to avoid it because it is a lot of money. It's not like the $95. It makes crystal clear sense to avoid the Cadillac tax.
One of the things I had heard is, you're saying it's on the employer, but I had heard it was going to fall on the employee too, because of the fact it was either like 12.5 or 14.5, that if we're paying more than that,
you're right,
that the employee would have to be, because that's an additional benefit to them as far as taxable.
So the regulation is not clear on this, but what lots have asked for clarification on is that after it gets above that amount, the employer no doubt has to pay a penalty for providing this really rich coverage. Where we're waiting for clarification is that since the employee is paying, their contribution is pre-tax dollars, should they no longer get that tax benefit if they're getting that, and we're waiting for clarification on that. I don't know, you could, I don't know where they'll land, but you could see if the opinion is that a rich plan should not get the same tax benefits, it would seem like it could fall to both the employee and the employer, but waiting for clarification.
On the radio this morning, the talking heads were discussing this issue of the Affordable Care Act. One of the things that politicians are pointing fingers at the insurance companies, and the insurance companies are saying, we're just doing what we're told by the law, but it's the president's statement, you can keep your same coverage. When the law was being debated years ago, he said, everybody will be able to keep their same coverage, when in fact, for small group or individuals, the Affordable Care Act is eliminating a lot of those current policies because they have to do what? Bronze, silver, gold, and platinum. So that was the debate this morning on the radio, was that who's at fault here? Is it the insurance companies because they're saying you can't have this? If I'm an individual and I have a nice policy that I want, I can't have that in 2014, correct?
So yeah, I want to stay away from the political debate on this. I hope you can appreciate, but if you're in the individual space today and you buy individual coverage from us, let's say you're not exactly your friend, but you're one of the people that buys those individual plans, those are all moving from us to sort of open marketplace plans. They're all moving to on exchange. So we didn't think we could have two areas, if you will, where individuals were buying plans from us. So they're all migrating to our on exchange plans. We know that those that buy them today, many of those people are likely not subsidy, qualified. So their plan, they're buying an off exchange plan today. They'll have to buy an on exchange plan tomorrow, if they're buying from us. And you're right, Jeff. That is the debate, and I've heard things like you can buy a similar plan to you have today, or yeah, that's a tough question.
But in that, I mean, each carrier, I would think would. You talk about individual plans. These are people who are not subject to subsidy. they're not gonna be able to get subsidy anyway.
Okay.
They're already paying for the individual plan, which tend to be higher if it's not group. So it would seem to me that each individual carrier, knowing that, and knowing what they have in terms of individual plans within your company, then you would have something on the marketplace that very well could be actually cheaper than what they're paying for an individual plan now.
Yeah.
You would tend to think it might be a little bit cheaper and actually and pretty much still get the same kind of coverage.
Yeah, I think you're exactly right. There are options out there, but if somebody said, can I buy the exact same plan today tomorrow that I'm buying today, I'm not sure we could say that yes to everyone. But absolutely you can say there are more options. It might be better for you, and it's very, very equivalent, if not the same. But people like to be very accurate on certain statements that they hear out of Washington, and right now I think that's one where there's some debate about. But I agree with your point. There's more options, very similar plans, if not exactly the same, and some people will benefit.
Where do you fall, where do the HMOs and PPOs fall? Are they, do they fall in does the bronze also have a PPO option, or is it only HMO option? Or does the silver have both? Where do they fall?
Great question. It's not as intuitive as you might guess. So PPO generally means lots of doctors and hospitals are in the network. It's open access. You go where you want. PPO plans, at least for us, fall on bronze, silver, and gold. So we have lots of different options there. Then we have kind of select networks, which are similar to PPO, but just a smaller, or it's a select group of doctors and hospitals, and still open access. You go, as long as you go to one of those, that kind of thing, you're considered in network. Those also fall on bronze, silver, and gold. HMO is interesting because people think HMO is a really restricted plan in terms of the numbers of doctors and hospitals you can go to. That's what people think in their mind. And sometimes it's true. But HMOs have really rich coverage. So they might have restricted restricted network in terms of doctors and hospitals, but the amount of coverage is really high. It's closer to that gold or platinum, because if you're in an HMO, you're generally paying a $25 copay or a $50 copay, really rich coverage. So people will be surprised that when HMO plans are on exchange, when they are, and they won't always be, they will be a little bit higher on the spectrum, more like in the area of gold than on what a lot of people expected, which was way on the left. But it's how much does the plan pay versus how much the employees pay. And in the case of HMO, the plan pays a lot. The employees generally don't pay a lot. It was hard for some insurers to actually to figure out where, to find that kind of price point and that actual value, on their HMO plans. So I don't think you'll see as many options for HMO on exchange in this first year as insurers are trying to figure it out.
On the networks for Blue Cross specifically, are you keeping the same names for the networks? Or are you creating new names, like the Select Network? You can say, oh, I know in the Select Networks we have it now, and I see it on the exchange. Okay, I can deal with that. Or is it a new name and got to figure it out?
There are a couple new names. It was unavoidable. So our HMO is called Blue Precision on exchange. It's not called HMO Illinois or Blue Advantage HMO, where is the naming convention there. And then the Select Network is called Blue Choice Select, and it's called Blue Choice Select today. So the name is, so the HMO is a different name, is the short answer. What we call Blue Choice Select today, which is a more select PPO style, that is the same name, but it's a different network. It's a new network now that it's on exchange. So got a little bit of a mixed bag. The HMO is a new name, but same provider panel, doctor panel. The select network has same name, but new provider panel. And then the PPO is still called the PPO. And I think you'll find that with all insurers. And some of the challenges that, we file our products with the, local departments of insurance, and when they start to look like a different network of doctors and hospitals, that kind of deems it a new product, and it needs to be sort of renamed and reshelved. So we're trying to push out as much information so people understand that we don't want anyone to be misinformed. I think there was another question in the back. How are we doing on time? Really? Fine?
15 minutes.
Okay.
The question was, so now that pre-existing conditions are taken into account, what about with group coverage? Because they couldn't exclude them, but they could rate to go up 67%.
Sure.
So is that still being underwritten the same, or pre-existing conditions not taken into account for your rating in group coverage? And then how does that affect the rating for a healthy group as opposed to a non-healthy group?
Yeah, good question. So pre-existing, the only thing that changed with pre-existing coverage is that they can't simply be denied or excluded from coverage, right? At a real high level, if you just think kind of macroeconomics, now all the pools are going to be rating for people with pre-existing conditions. They just don't rate at the individual. So if you have a pre-existing condition, Jeff's example, we don't rate that individual way up. It just goes into the price of the overall pool, the total performance of the pool. As far as group coverage and the way we do it today, we don't see that changing much, right? We will still look at the makeup of the group and make the appropriate premium decisions based on the makeup of the group, but we won't be denying anyone. Since there's now this new marketplace and it has rating that's defined in a certain way, we'll obviously look at our underwriting practices, make sure that makes the most sense. But for now, the way we rate group off exchange, we'll have the same approach. I offer, a couple people said to me, I'm hoping to get an education today. I hope we accomplish that for some of you in the room, but it's still more, you walk away from here probably being overwhelmed with the amount of information. If you're interested, either give me your name, an address, or your business card. If you're interested, I've got a bunch of information in this folder, and it's called Be Covered Illinois. And this is what I'll call, it's a community effort to get information out to as many people as we can about, generally speaking, health insurance, generally speaking, the Affordable Care Act and what it means. And this is not a Blue Cross is involved in this, but you won't find the Blue Cross or Blue Shield anywhere on this. But there's a lot of information in here that you might find helpful as you're thinking through what's important to your employees. So for example, we have a glossary of terms. There's probably 30 or 40 terms on here in terms of preventive screenings, qualified health plan, individual mandate. What are those things? They're all defined here. It's both in English and Spanish. And then there's other information out here on, if I'm looking to buy an insurance product on the exchange, what do I need to do? It says go here, walk through these steps. The top 10 things to know about the Affordable Care Act, they're largely the things I kind of breezed through, meaning preventive screenings, qualified health plan, that kind of stuff. So if you're interested in a whole lot of information and kind of looking at what might be important for you, either your member companies or your employees, I'd be happy to send you, this kind of information. Or you can we have a toll-free line. We are largely doing this for what I call community partners because the Affordable Care Act asks the community to get involved. So churches, community centers, libraries, qualified health plans, people, organizations that provide health care to those in need today think about it, they're in desperate need of this. They say, wow, I get people that walk through my door today, we give immunizations out, let's say, right? And none of them have coverage. I'd love to be able to tell them what maybe they can get insurance tomorrow. So we did this largely for community partners, those kinds of people, to say, here's, in the spirit of public service, here's information on the Affordable Care Act. But what I'm finding is a lot of our customers are saying to me, Kevin, send me that information. I'm going to read it over the weekend. Tell my people that help run payroll or that talk to my employees to pay attention to, a handful of these things. So I'll leave you with that. If this would be of benefit to you, we'll send you a handful of these and you can read it, and hopefully it helps you in your business as you deal again with your member companies or your employees. Thanks for your time and attention today, and I hope you found this helpful. Appreciate the questions as well.